Hello, and welcome to the Exploring Careers in Local Public Health presentation. My name is Amy, and I'm very excited that you're here today. Just to start, I would like to introduce myself and just so you know who I am and what I bring to this presentation. So, like I said, my name is Amy McInerney. I am the Assistant Director of the Pathway to Local Public Health program, which I'll talk more about later in the presentation. I work for the Massachusetts Health Officers Association, which is called MHOA for short. Again, we'll talk a little bit more about MHOA later, but essentially MHOA is a professional organization for health department staff throughout the state of Massachusetts. So if you hear that and you're like, I don't know what any of that means, don't worry, we're going to go through all that today. But just so you know, my experience is I have 2 different degrees in public health, and I've also worked in local public health for 5 years, including roles as a health inspector. So I'm very excited to talk about this work with you. Just to make a note, some of the slides in this presentation are a little bit word heavy because I want you to have as much context as possible. The great thing about this being pre-recorded is you're free to pause at any time. So if there's anything that you want to read more about or you just want to read without me talking, you're free to do that. And of course, if there's any follow-up that you have, you are free to reach out to me. I'll give my contact information at the end. So just to start, I want us to define what public health is because I know some of you watching, public health might be brand new to you. You might not have a public health program at your school, but you might be interested in the field. So I want to make sure that we all have a good understanding of what public health is. So I'm going to read out this definition to you. This is going to be one of the few things I read right off the screen, but the definition of public health, according to the American Public Health Association, is public health promotes and protects the health of all people in their communities. The science-based, evidence-backed field strives to give everyone a safe place to live, learn, work, and play. So essentially, public health is protecting people on the community level and is really focused on prevention and building infrastructure to help people be able to be safe and healthy in their communities. So that is public health generally. Public health is a very broad field. If you look more into what public health is and what kind of jobs are available, you're going to see a very, very wide variety of things, which is very exciting. But for the purpose of today's presentation, we're going to be talking about something called local public health. So what is local public health? This is the work that is happening in specific towns, cities, and regions that is focusing on the community that it's based in and is usually within the structure of a local government. So essentially, local public health, especially in Massachusetts, means health departments. So you might have heard of a health department before, it might be new to you. We're going to go through that today, what that is and what kind of work they do. But local public health is a little less abstract than other public health fields that might work on a much broader level. This is a lot more what we would call boots on the ground type of work, where you get to see how the policies and enforcement and outreach efforts that you make actually make a difference in the community in real time, which is very exciting. So, like I said, you might have heard of a health department. You might have somewhat of a working knowledge of what they do, or it might be very new to you. We're going to define what a health department is and the type of work that they do. So, health departments essentially are working on enforcing a variety of regulations and rules that exist on a federal, local, and state level to make sure that the community is safe. So you might also see department referred to as the Board of Health. You might have heard of the Board of Health. It's usually the same thing, but they're all doing very similar work across the state. So these are some examples we're going to go through of what a health department does. So the first thing and something you might be the most familiar with or you might have heard a lot is food inspections. So food inspections are enforcing the food code, which is a federal regulation that ensures that places that are serving food to the public are engaging in food safety and sanitation practices to help minimize the spread of foodborne illness. So essentially, these inspections are making sure that the food is safe to eat, that the people serving the food are doing the right practices to make sure that no one is going to get sick from eating that food. So food inspections might be what you think of first when you think of a health department, but there's plenty of other work that we do. Another example is a housing inspection. So this is making sure that people are living in places where they're not going to get sick or injured. Usually this will happen, someone will call and say, hey, I think I have mold in my house, or hey, I don't have hot water, I need help. And then the health department will go out, confirm that those things are happening, and then work with the person who owns the property to ensure that whoever is living there is living in the safest place possible. There's also infectious disease case investigation and surveillance. So there's a list of reportable diseases in Massachusetts. So if someone were to test positive for this, it has to be notified to the state. So that's things like salmonella, botulism, anthrax, E. coli, so on and so forth, things that are infectious and can infect multiple people, those will be reported to the town where that person lives, and then that health department staff will follow up to make sure that they are safe and also take the steps necessary to ensure that that illness doesn't spread. There's also community outreach efforts, so things like health fairs, Narcan trainings, CPR trainings. You might see those advertised sometimes. Those are usually done by the local health department to have opportunities for the community to connect and learn about various health education efforts. But that's not it. There's so many other things that health department does. These are just some more examples, but seriously, there are so many things that health departments do. You'd probably be very surprised how many different areas the health department can touch for just one town. So these are just some other examples, but it's truly not an exhaustive list. So with that being said, what kind of careers can exist in local public health? Well, there's a bunch. As you can imagine, a health department does a lot of work, so there's a lot of different positions that can exist. The most common one, or the one that people might associate with the health department the most, would be a health inspector, which we are going to talk a little bit more in this presentation. Health inspector will do those food inspections and those housing inspections, but there's also public health nurses who will do those vaccine clinics and infectious disease follow-up. There's epidemiology, which is more statistical and about the study of diseases over time and different reporting. There's also substance use prevention, tobacco enforcement, so on and so forth. There are so many things that you can do in local public health, which is very exciting. And what are the benefits of working in local public health? So you might hear me say all these things and you're like, that actually sounds kind of interesting, but like, would that be a good fit for me? Well, here's some things that can maybe help you make that decision on top of other things that we'll talk about later. First is, as I said before, you make a direct impact in the community that you work in. That is the nice thing when you go out, for instance, if you're a health inspector and you do inspections that are routine, you can actually see how someone improves over time. You can see how different regulations you pass can improve the community that you're in. It's very exciting work because you really get to see the efforts that you made actually happen over time. There's also a lot of room to grow and expand throughout your career. There's plenty of places that you can start in local public health and then work your way up. There's also, of course, different towns that you can work in. It's really exciting because there's always different things going on in different ways that you can expand your role. There's also a very close-knit professional community. So in Massachusetts, every health department is in every town. And so you really get to know the people that work in the surrounding towns. You all kind of go to the same training events. It's very nice group of people that you get to know. This is just a picture of some of them who work directly with MHOA, which is really nice. And then another perk is that government and municipal jobs have great benefits. So really good insurance packages, you get a pension or good retirement, things like that, a lot of good job security that is really good to consider. So I said all of this, and again, we're going through this quite fast, but if you heard any of this and it kind of perked your ears up and you're interested, here is some information on how to start pursuing a career in local public health. So to start, you would definitely want to try to pursue a major in a related field, whether it's public health specifically or anything that would be adjacent to that, so like health sciences or biology. If you can, pursue an internship at your local health department, so you can really just search up the health department for the town that you live in. So let's say you lived in Westford, Massachusetts, you can look up Westford Health Department. It'll give you all that information on the town website, and you can just reach out to them and say, hey, do you have any internship opportunities? I'm really interested in public health. And then you can see what happens from there. You can also work in public health adjacent jobs. So things like food service, you could work a part-time role in local government. It doesn't have to be a health department. It can be another department, but part-time like administrative work, things like that. And then any community health work that you can find. You can also just contact your health department. You don't even have to ask for an internship. You can just say, hey, I would love to know what you do. Could I talk to you for like a couple of minutes? Could I visit your department for a day? I'm trying to see if I'm interested in this work. They'll certainly be open to that. Of course, you can also sign up for the MHOA newsletter or join our student membership, which I do have a QR code if you'd like to scan to check that out. And then MHOA puts on a lot of different training opportunities. That's the great thing about a professional organization like MHOA is we have a lot of different events throughout the year to learn about local public health. So certainly if you sign up for our newsletter or our membership or both, you'll get access to when those events are going on. So a good way to get into local public health is through a position called health inspector, which I've talked a little bit about. so far in the presentation. But a health inspector is someone who conducts inspections, will respond to complaints and emergencies, will investigate various dangerous things like foodborne illness outbreaks, and build relationships with the public and local businesses to make sure that they are practicing good public health practices. So this is a really hands-on role. You're really out in the field. It's very exciting. It's very new every day. And this is a great entry-level position. Really, for most people that work in public health, this is where they start. So I've gone over health inspector work very broadly, talking about those food inspections, housing inspections, talking about how they interact with the community. But you're hearing all this, maybe you are interested, but you're not really sure because you don't really know a lot yet. Well, let me get a little bit more into the details of what a health inspector does day to day, and that might be a good fit for you. So if you are someone who likes to be out and about, you don't want to work an office job, you want to be kind of out in the field, this is definitely a great position for you. If you're someone who wants a lot of variety of work, this is definitely a great role for you. A lot of inspectors will say that they love this job because no 2 days are the same, which is true. You just never know what's going to come up in any given day. So if you like a lot of variety and you like to be out and about, this is definitely a good role for you. If you're also someone who wants to be challenged pretty regularly or you want to always be learning, this is definitely a good position for you. There's always going to be a new problem that comes up in the town that you have to address that you might have never seen before, and you're going to have to figure out with the information that you have and with working with others how to solve it. And then this is a really good role for becoming a leader in your community and becoming a leader in general. This is an authority figure role because you are enforcing various policies and regulations, and people do have to listen to you. So you're going to naturally build those leadership skills, and it's a really good way to make sure that you are secure in your choices and your confidence as a person and in your profession while also building trust with the public. So this is something that you're interested in, you kind of feel a calling to be someone in your community who makes a difference. This is certainly a great place to start. So with all that being said, there is opportunities to actually directly get some inspector experience and work in the field before you're actually hired as a full-time person. So like I had mentioned at the beginning when I introduced myself, I am the assistant director for something that is called the Pathway to Local Public Health Program. So this program is a health inspector traineeship. We don't call it an internship, we call it a traineeship because it is a little bit longer term for community college students only. So we don't take on anyone studying their bachelor's or master's. We only do people who are studying for their associates who are interested in local public health. This program is about 6 months long. You are placed at a local health department and you learn how to become a health inspector. So you're going to be doing some online work that all health inspectors have to do. You're going to be, of course, like I said, in the field, in a health department, learning how to do inspections and eventually doing them on your own. And then you'll also obtain several required certifications that all health inspectors have to get. So by the time that you finish the program, you're actually going to be ready to be hired and have some pretty good experience under your belt, and you're going to be leagues of bounds ahead of people who are trying to enter the field with no experience at all. So this program is part-time. It's 19 hours per week. It's hybrid because, like I said, there are some online trainings that go with this work, and then it is paid. You are paid a monthly stipend for your time, and you can actually get more money as you get more certifications, things like that. So there's a lot of incentives to participate. And for the people that have completed this program so far, we are still in our pilot phase, but we do have students that have completed the program. A majority of them have been hired into local public health departments and are currently working in the field, which is really exciting. Some of them had started saying they weren't sure if they were interested in public health in that way. They weren't sure if they wanted to do inspections, but most of them finished and they were like, I really like this. I'm going to continue on. And even some students who decided inspections weren't for them, they're still working in public health and they're doing it because of this program. So our next cohort for Pathway to Local Public Health will be winter 2027. So starting very beginning of January 2027 in the new year, and we'll go through June 2027 for 6 months. So we are going to have our applications open October 19th and be open for 2 weeks and close on November 2nd. So if you're watching this around that time or even before, certainly keep an eye out for the application. And if you're watching this after November 2nd, but it's, still before January, you can please reach out to me and see if there's any opportunity for you to join. But keep an eye out for those applications and certainly reach out to me if you would like one. And if you also want want to apply, but for whatever reason don't want to reach out to me, you can reach out to your career services staff and I am in contact with them. They can provide it to you as well. But I hope you'll consider applying. Something else exciting that we are doing is we have the MHOA conference. So like I said, I work for MHOA. MHOA is a big professional organization for health department staff. We put on an annual conference every year. This year it's going to be in Springfield, Massachusetts. It'll be October 28th through 30th, so about 3 days. We do have a student scholarship opportunity for community college students. So this scholarship will cover the attendance fee, your lodging, and most meals. This is a guided learning and networking opportunity. So if you were to be accepted for the scholarship, you would work very closely with me leading up to the conference and during the conference. It's not something where you get accepted and you fend for yourself. You'll be working closely with me to make sure that you get the most out of it as possible. And this is a great way to see if you're interested in the field of local public health and also make some professional connections while you're there. So if you are interested in this and it is before October 28th, please reach out to me. We do have applications that are going out. They will be due September 25th. So if you are watching this past September 25th, but it's still before that conference date, please feel free to reach out to me and we can see if we can get you to go. And generally, if you want to learn more about local public health, there's a few different resources here. You can either go on the MHOA website. You can also go to the State Department of Public Health website. You can look at the Pathway to Local Public Health webpage, and you can also Google your town's health department webpage. So for instance, if you live in Lowell, you could search Lowell Health Department. You can look up their website and see the kind of work that they do. And of course, you can contact me if you would like to learn more. That is my email right there. It's just my first initial last name at mhoa.com. And then you are free to also contact your career services staff at school so they can also point you in the right direction. But generally, you're free to reach out to me at any time. It can be about Pathway to Local Public Health. It can be about the conference. It can be general questions about local public health. Totally up to you. I'm happy to talk with you. So with all that being said, that is a very quick run through of local public health. I hope some of that piqued your interest. I hope you're interested in pursuing either the scholarship or the Pathway to Local Public Health program or both. Again, please feel free to reach out with me with any questions. Please apply for that conference scholarship if you're within that time frame and you're interested and you're able to go. We would love to have you. And I hope you consider a career in local public health. Thank you so much for watching, and I hope that I follow up with you soon.